Welcome back to Business First TV. My name is Tino. I am so fortunate to have with me today Jackie Knight from a company called A New You in Brighton. Jackie will tell you what they specialise in. And we want to talk today specifically about man boobs. Yeah.
Okay.
So Jackie, just tell us a little bit, for the people who are watching, tell them what you do.
Okay.
And then we'll talk about, my man boobs.
Okay. So A New You is a private cosmetic surgery clinic which also undertakes non-surgical treatments on site. So man boobs, the term that is known for, the medical term is gynecomastia.
Wow.
Okay, so say that when you've not had too much to drink. But man boobs is a common problem with a lot of men. A lot of men they think it's not very common, but it actually is. You often see men on the beach in Brighton won't take their t-shirt off, and they actually are going into the sea with their t-shirt on. So
right, okay.
So what is man boobs? Man boobs is something which is usually caused by the gland that sits behind the nipple area, and it becomes enlarged. Okay. Sometimes that man boob comes as a result of being previously on steroids. Okay. And sometimes it's a hereditary thing. Okay, the father or somebody may have had a bit of extra fleshy fat around that area, which can make them look like they've got a small breast. Okay,
now these aren't just, they look like breasts, don't they? As opposed to a guy who's just fat, like myself, for example. I'm overweight. I couldn't wear a bra, but I can see I'm bigger than the average guy.
Well, the difference is one is flab, as in loose skin, and a bit of flabby. Usually gynecomastia, if it's true gynecomastia, you can feel the gland. It's hard. Oh, wow. And then around it, you can have some fat cells, which we remove at the same time as the gland.
I was going to ask you how they feel, let me know, but I won't right now. Go on in there, it's okay.
So it's usually quite hard, like a little marble, but a bit softer. Okay. But around that gland is often a deposit of fat as well. Okay. So we often take the gland out and also remove the fat.
And is this done in the clinic?
We wouldn't do that procedure in the clinic, no. It would be done in a proper hospital. It can be done as a day case. People don't need to stay overnight. We see the patients, we prep them all before they have the surgery, like do relevant blood tests or whatever they may need beforehand, but it's done as a hospital, at a hospital as a day case usually.
And what is the problem with these things? That people just people are ashamed of them? People don't feel good having them?
Well,
wearing their t-shirts.
Men want to look, if they take, it can usually affect a lot of fit men. They go to the gym and they just say, I can't shift this. Everything else in my body is very toned, and I really want to shift this bit of fat or this glandular problem. And it's often something they can never deal with through exercise or going to the gym. Okay.
And I imagine, do they get sore and so on as well?
Some people say that, some of the men that I see do say it can cause a bit of soreness, but on the whole it's more about how it looks when they haven't got their shirt on.
Okay, all right. Now you've been doing this for about 25 years, how long have you been doing?
That's right, yeah.
25 years, and you've got a medical background and stuff?
Yeah, I did my training as a registered general nurse many moons ago, and I started to work at East Grinstead where there's a plastic surgery division, and as I worked with those plastic surgeons, they always did a little bit of cosmetic surgery as well. So I actually liked that side of the industry, and so I've stayed in it ever since. Really.
You liked hurting people, like cutting them up, that's what it was.
I like making them feel better.
Okay.
Yeah, they feel better, they feel more confident. A lot of what we do in the clinic is all about confidence. Okay. We try not to hurt people, but sometimes, there will be a bit of discomfort. It can't be all completely pain-free when we're changing things.
You cut people, it's going to hurt.
It will, but they're usually asleep when it's done, and then they've got a small amount of recovery. When I started in the industry 20 odd years ago, we would have to tell people with facelifts that they need 4 to 6 weeks off.
Wow.
No longer now, 2 to 3 weeks, and they've still got some tenderness there, but they could go back to work after 3 weeks, not 6.
And what's the process? If I decide that I want to get rid of my man boobs today, what have I got to do?
Okay, well, you'd first of all come in and have a comprehensive consultation. That would be at the clinic in Brighton, where we would examine you, we'd take a full medical history.
When you say you're going to examine me, what are you going to do?
We've got to look at the area that you're concerned about. So in your case, it would be your man boobs. So we would look and see whether it is just fatty tissue or whether there is a glandular problem. Take a full medical history, find out if you've had any hormone tests, whether you've been on steroids, how long the problem's been there, and how much it concerns you. So we need to find out on, a scale of 1 to 10, how much it really bothers you.
Okay, all right. And then what happens?
Then we would do a pre-operative screen. Once you've seen the surgeon and had a pre-op screen, you could then have the surgery. But at the surgeon's consult, we'd go over everything all over again after the initial consultation, and the pre-op screen is just medical screening like swabbing and blood tests, and telling you again what to expect. So you will have been told 3 times what's involved for the surgery.
And then one day I go to a clinic, to a hospital somewhere and...
Yeah, we can arrange transport to get you there. You always have a driver to bring you back, so that
That's
we know
really
you're
good.
home safely. And yeah, it's done under general anaesthetic. On occasions we've done this procedure under local, but more often than not, Man Boobs, we try to put you under a light general so that you recover sort of 4 to 5 hours afterwards in the hospital, and then our driver takes you home. Then all your aftercare would be done back in the Brighton clinic.
Bit of scarring perhaps?
Tiny little scar, usually around the nipple area, and maybe one just underneath the armpit, just inside the armpit area. And then one stitch maybe need to be removed a week later.
Wow, okay. And best guess, and no one can hold Jackie to his cost, okay? Best guess today, what would be the cost roughly?
Roughly for gynecomastia, you'd probably be looking at a cost of about £5,000.
Is that each or for both?
No, that's for both.
Okay, all right, there you go. So about £5,000.
Somewhere between 5,000 and 6,000, depending if we're doing lipo and removing the gland.
Okay.
And that would include surgeon, anaesthetist, time in the hospital, all your aftercare, and you do need to wear a special garment afterwards, which is a compression garment, like a firm vest, which has got hooks and eyes on it to keep the skin to go back into the place where we've removed the fat and the gland.
I'm impressed. Okay, so anybody who's watching today who may want this sort of procedure happening, if you're not happy with your own body, then do give Jackie a call. Jackie, what's the best way to get hold of you?
Best way, you can either give us a call on 01273 604444, or you can look at our website, but really it's best to come into the clinic and be properly examined, and then we'll tell you all the pros and everything to expect.
Amazing. Thanks for coming and sharing again today.
Thank you.
The Jackie deals will be on the bottom here somewhere, there-ish about. And if you are a man and you're unhappy with the way you look, or a lady unhappy with the way you look, do give Jackie a call. Thanks all for watching.
Thank you.